Any questions? I know some of you had questions for Matthew. Perhaps you caught him at the end, but any particular questions? Well, that's a change. In the corner later. I thought there was something. Always got to be a first person. Just say who you are, please, and who the question's addressed to. Thank you.
Hello, I'm an AHP. I just had a question about, somebody mentioned earlier that the funding was kind of due to end now. And myself and my colleagues have found the health coaching really invaluable in our work. And my question is really, I noticed in the booklet that there are kind of dedicated named people per trust or per organisation that have helped spread the word and got their colleagues and their employees onto the course. And I just wondered if there was a plan in terms of moving forward with that, whether those people are able to coordinate kind of locally, groups to be able to kind of get together and continue to spur each other on, a bit inspired by kind of Matthew's talk and that social movement type of thing, to support each other as well, kind of but more locally.
Who'd like to respond to that?
I think I better respond. I'm not really on the panel, but I better respond to that one. Yes, there is named people. They've been acting as coordinators and helping get participants on the programme. I think that's a really good idea to get together. At the moment, we are using the evaluation and the results from today to build a case for further central funding. But of course, we're all leaders. And as Matthew says, this could be part of core business. So I think use the resource that you have, get people together that you see in the list at the back. Also contact your trainers and knock on doors.
I think the other thing is all the providers in the room, your organisations are part of Health Education England. It's a provider-led organisation. And there is a steering group in Norfolk and Suffolk. There's one in Essex, one in Bedfordshire and Hertfordshire, one in Cambridgeshire and Peterborough. You need to use your networks through that route as well to make sure that actually they're using all their money up this year. And if not, why not put on some extra training for train the trainers and actually network between the organisations and just kind of harangue and harass your representatives on those bodies. Karen, who's in the corner, can probably aid you in navigating through that route. Do you want to stand up, Karen, so people can see who's on those particular groups in Health Education England?
Yeah, sure. I mean, in terms of ongoing rollout, essentially we will be working with organisations to see how they want to take it forward. There has been some discussion in each of the workforce partnerships, and obviously want to build and capitalise on the work that's done. So absolutely, we'll make sure that there's feedback from this event, and obviously ongoing work in terms of the evaluation. Okay.
Thank you, Karen. Any more questions? Surely you're all dying to go home, aren't you? I'm sure you are. Any particular compelling points you want to raise at all this afternoon? Okay, all right. I think just one from myself, maybe for the panel. I think just in terms of observation, and aside from Matthew's remark about my name dropping, I wanted to. I think the point we're making, and particularly there's another council that I was talking to yesterday, Newham, sorry, and. In that particular location, they've more or less within 2 years got the entire community serving themselves. And okay, it's not specifically healthcare, but it's public services at the end of the day. They're taking responsibility, and there's a massive drive, and there's huge savings, etc., etc. But where within healthcare? I mean, we've talked about it today, and I think what we've seen in terms of the course of this morning and this afternoon, compelling evidence that this all works. It makes sense. I think the description that was used this morning was no-brainer. Sadly, sometimes in the public sector and indeed the NHS, you hear that word quite often. But given the level of common sense, I mean, what are your views on actually engaging the public and getting the public to drive this, rather than us coaching them along, but really starting to get a real pull to come out of the communities that we serve to make this their responsibility as much as it is ours to deliver? Kath, sorry to put you on the spot, but you were...
The thing that always comes to my mind is a green agenda, and it was children and young people who actually got us all recycling. They went home from school and they actually said, you know what, we should actually be recycling these cans, etc. And we all got on board, and it spread. What work are we currently doing with our primary schools and with our secondary schools to really engage them in conversations about health? They are our future parents and our future users, and those people who will have those long-term conditions, who will require different approaches as we go forward. Our prevention and our focus on children and young people is so critical. In Gateshead, we did a bit of work. The kids there said, you know what, we've all got school diaries. Why don't we have health information in our school diaries? So that's what we did. We went back with a sticky insert. The kids all stuck them into their school diaries. 6 months later, we actually went back and we evaluated the impact. 86% of them said they'd either use that health information to actually divert themselves from A&E to use a local pharmacy or NHS choices, or used it to influence their family and their friends. We neglect children and young people at our peril.
Thank you. Thank you. Okay, right. I think just to... Oh, Matthew?
So, I mean, Angie, there's one other area. I mean, lots of you will belong to foundation trusts and be part of them and employed by them. They all have thousands of members. And so I imagine your comms teams each month, when they put out their bulletin, scratch their heads for stories and issues to put in there, because how many more things can they recirculate and redo? Why don't you go and see your comms teams and put in something in there which is reaching 30, 40,000 people in your local neighbourhood, and then that is something that they can read, and then they can expect that when they come into the hospital, the mental health trust, the community trust. That's another way you could do it within your organisations.
Sue.
The simple fact is that whenever the population are asked, they always say, a large majority always say that they would like to be more involved in their own health and that they would just love to have more support to be able to do it. It's really an open door, and making that expression much more public. And for instance, commissioners have a responsibility to consult with their populations. They need to maximise the opportunity for that voice to come through so that they can actually use it.
I guess the other thing that's worth thinking about is thinking about where one has conversations about this with the public, in a sense, rather than actually having the conversation once people have already hit healthcare. And so locally we're talking about running a sort of a week-long session in the local, it's Templar Square in the centre of Oxford. It's not central Oxford as you think of it as in terms of Dreaming Spires and all the rest of it is central Oxford as in Cowley, and pretty deprived actually. So we're going to be running a pop-up shop because there's a lot of empty shops, and using that as a space to talk to people about health and healthcare, hopefully to get them a little bit interested, so that actually when they do hit healthcare, that actually some of these conversations might be something that they want to engage with as well.
Thank you. Okay, so if there are no more questions, what I'm going to do is just really ask, if I may, the panel, starting off with Sue, just really summarise their perception of the day, you know, a key highlight for you, just one each, please. Then I'm going to ask Penny to wrap up with some final comments.
The key highlight for me in what has been a completely inspiring day is the certainty that actually attitudes and mindsets have changed across a huge number of people from a huge variety of backgrounds. And the key thing is the recognition that people are resourceful, that they have a huge degree of strengths and resources, that the answer to most problems will be within their setting and their grasp. And I think for a programme like this to have achieved that mindset change is truly remarkable.
Seconded. I mean, it's been a really great day, and I've really enjoyed it. And I guess, I suppose one of the key messages for me was the sort of the importance of context. I think Alf said in the morning that the Co-Creating Health programme, what they learnt about that was how important the context in which you do these things are, and that I think came out in some of the evaluation here, and then certainly in some of the discussions. And so that's the bit that actually it is about all of us. If we are all part of culture, if we are all about sort of, you know, being able to change things locally, then actually it is about trying to create some of that appropriate context or receptive context, and that's something we can all do. It's not just about the leadership, whilst that's clearly important.
Two things. I mean, A, the number of people here were enthused to do something different, which is fabulous. You don't always get that. And then secondly, would have to be listening to members of my trust saying how fabulous they are, and just doing it and showing that it's just naturally part of what they do, and their stories are just brilliant. But I'm biased.
I've just been reflecting today about, you know, some of these change cycles. If you think about the one for new technologies, and I see Andrew and Penny as, you know, kind of real innovators starting all this off 4 years ago. And I see you all as the early adopters. You've come forward for this health coaching, you're using it. And I think the challenge for you all now is to go out and get the early majority involved in this, to get up to the top of that curve before you start worrying about the late majority and the laggards with it. So I think you should think of yourselves as early adopters and follow what Pete Moore said this morning. Just go out and make a difference. Well done.
You know, the real highlight for me was hearing David. I don't know if David's still here. Physiotherapist, there we go, give us away. You are a true role model, sir, in how you've actually embraced this and how it's changing your practice, but critically making a difference to the patients that you serve. So thank you for being an inspiration.
Okay, right, before I just hand over to Penny to some final comments, it's down to me to just provide some quick thanks, if I may. I mean, first of all, a big thank you to all of you here for being here. As Matthew said, the enthusiasm that we've got in this room is phenomenal. So please, give yourself a great hand for this.